Hello, I'm Dr. Kathy Jones. I obtained my medical degree from Wake Forest University School of Medicine and completed my residency in OBGYN at New York University Medical Center. I received my fellowship training in urogynecology and reconstructive pelvic surgery at Wayne State University Hutzel Hospital. I'm board certified in gynecology and the subspecialty of urogynecology and female pelvic medicine and reconstructive surgery. I practice in Orlando, focusing my work with women with pelvic floor defects, such as urinary incontinence and painful bladder syndrome. Today, we are talking about pelvic organ prolapse. What is pelvic organ prolapse, and what are the symptoms and its causes? Pelvic organ prolapse is a hernia of the female organs such as the vagina, uterus, cervix, bladder, and/or rectum. It is sometimes referred to as a dropped bladder, or a dropped uterus, or a dropped rectum. Other common names include cystocele, rectocele, or interocele. Symptoms of pelvic organ prolapse can present as a bulge in the vaginal area, or as vaginal pressure or heaviness after standing or walking for long periods of time. Some patients may also notice a soft ball-like structure at the vaginal opening while wiping or showering. Pelvic organ prolapse is caused by the weakening of the muscles and tissues that support the vagina and uterus. Pregnancy and childbirth are some of the main causes of this tissue weakening. However, prolapse is also associated with repetitive heavy lifting, chronic constipation, chronic cough, or poor genetic makeup. How is pelvic organ prolapse diagnosed and treated? Pelvic organ prolapse is usually diagnosed by your doctor during a pelvic examination, which may include standing up, bearing down to ensure that the bulge is visible at the vaginal opening. There are both surgical and non-surgical treatments for pelvic organ prolapse. The non-surgical options include pelvic floor exercises, such as Kegel exercises, physical therapy, and mechanical support of the vagina with a device called a pessary. If a patient's symptoms are severe enough, surgical options include a cystocele and/or rectocele repair, vaginal vault suspension procedures, and sometimes the removal of the uterus with a hysterectomy. Mesh as a treatment, what are the facts? Surgical treatment of pelvic organ prolapse that includes mesh should be reserved for severe stages of prolapse or recurrent prolapse for which traditional surgical repairs have failed. For pelvic organ prolapse, mesh can be surgically placed through the abdomen or through a vaginal route. In 2011, the FDA released a safety warning on the use of mesh placed in the vagina for prolapse repairs to identify concerns over complications related to these repairs. The routine use of vaginally placed mesh for first-time surgical repairs of prolapse is discouraged. The decision to use mesh for any prolapse repair warrants a thorough discussion outlining the risks and benefits of its use between the patient and her doctor.